PrePrep is a sterile barrier dressing that eliminates the use of expensive surgical suite time, personnel, and effort to perform antisepsis of the operative site by moving it to the preoperative holding area. The PrePrep device is supplied in a sterile peel pack which also contains the instructions for use, sterile latex gloves, and a drape. Various styles, lengths, and diameters match different surgical areas of the body, upper torso, lower trunk, and extremities, as well as sizes of patients. Prior to application, always double-check the location of the surgery with the operative chart, surgeon, and with the patient. For lower leg surgery, PrePrep is applied over the foot and slid proximal as needed, where it is lightly cinched by tightening the cord ties with the cord lock. This results in a closed environment for antiseptic preparation to take place. 4-ounce bottles of antiseptics such as isopropyl alcohol, chlorhexidine gluconate, and povidone iodine are available. The first antiseptic bottle is screwed into the cap attached to the plastic tube inside the PrePrep. Squeeze the bottle such that there is enough fluid to cover the patient's skin. Repeat with any additional antiseptic of choice. Using the plastic bag, rub the fluid around all areas within the bag to ensure full coverage of the patient's skin. Once the skin is covered, pull the tubing from within the PrePrep. Suction is then applied to assist with evacuation of any liquid antiseptic and with drying and removal of flammable vapors. Once dry and prior to transporting the patient to surgery, the cord lock is tightened, tied, and the excess cords cut just above the knot. Suction is removed and the port is recapped. The patient can now be safely transported to the operating room. In the OR, the patient is positioned on the operating table. Prior to anesthesia, the PrePrep is removed in just seconds while being careful to maintain the sterile operative surface. Lengthy lifting and holding of limbs has been eliminated. Proper draping is completed as usual and the surgical area is ready to operate. OR staff can now focus on other important duties without interruption. Only PrePrep allows proper antisepsis to be completed in pre-op, resulting in a reduction of total surgery time.